Well, good evening to you and thank you for joining us. I'm Britt Marino. FDA approval of Pfizer's COVID-19 vaccine could pave the way for more vaccine requirements. KXAN's Jacqueline asked legal experts if there's anything the governor could do now to stop vaccine mandates, and she's joining us now in studio tonight with their response.
Yeah, Britt, you might remember that last month, Austin Mayor Steve Adler said that he wanted to require all city employees to get the vaccine or be tested regularly, but the city ultimately didn't mandate the vaccine for employees because of the section you can see behind me of the governor's executive order. It says no governmental entities can make employees get a COVID vaccine administered under emergency use authorization. But now that the Pfizer vaccine has formal approval, no longer just an EUA, legal experts I spoke to believe that opens the door for mandates within cities, counties, and schools.
Just like schools already require several FDA-approved vaccines for students,
I think that we can understand the full approval as generally clearing the way for a mandate. That mandate would still have to have applicable exceptions, such as for religious beliefs and medical contraindication.
And legal experts say that wouldn't only apply in schools. Civil rights attorney Mike Siegel points out that when he worked as a city attorney for Austin,
I had to be vaccinated to go work at City Hall. And to me, that same kind of common sense requirement would apply to COVID-19.
It's his opinion that if the governor tried to stop Pfizer vaccine mandates now, it would be illegal.
Governor Abbott is using the Texas Disaster Act to issue these emergency orders. And those laws that he's relying upon are about protecting lives. And this would be the opposite of that.
But the idea of COVID vaccine mandates is still scary for some. Austinite Adelina Adame says her family is being careful, keeping the kids at home to learn virtually.
If we go out, we do mask up, we hand sanitize, we spray down our items that we bring in.
But what they won't do is get the vaccine, not even Pfizer's.
It's so new. I'd rather wait and, give it a couple more years and see, just because, personally, I'm not trying to be an experiment with these things.
Health law expert Keegan Warren Klim stresses that with emergency use authorization or FDA approval,
it's really important that people trust the process, trust the experts, and trust that they have done the research.
I asked the city of Austin if it might move forward with a vaccine mandate for employees now. The mayor told me in a statement that he's evaluating all available options and resources to keep city employees safe. Tonight at 9 on the CW and 10 on KXAN, our Alex Capriello is looking into the possibility of Pfizer COVID vaccine mandates within school districts specifically. Brett?
Thank you very much, Jacqueline. The Department of State Health Services has the authority to set immunization and vaccine requirements in Texas schools. Currently, the COVID vaccine is not required, but 7 others are. Tdap, the tetanus, diphtheria, pertussis vaccine, polio, MMR, measles, mumps, and rubella, hepatitis A, hepatitis B, varicella, that's the chickenpox, and meningitis. These are all required at varying points and doses depending on grade level. Exemptions are allowed. However, there are rules for a medical exemption. You need a doctor to provide the reason for the specific vaccines a child cannot receive. And there is also the reasons of conscience exemption, which includes religious beliefs. However, schools maintain an up-to-date list of students with those exemptions. And in times of emergency or epidemic, those students with exemptions can be excluded from school and sent home for their safety and the safety of others.